At Northwell Health's LIJ Forest Hills Hospital, healthcare workers are preparing for a potential surge of coronavirus patients. Officials here are concerned this could become an epicenter for coronavirus, but say they are prepared.
The issue that becomes each and every day making sure that you have the right staff with the right skill levels. We're well prepared at the moment, and we will be well prepared no matter when that apex comes.
We have 21 new cases that we found, so we're a total of 76 in the state of New York right now.
We are certainly in New York seeing a rapid rise in the number of cases and the rise in the number of patients that are hospitalized.
It would be nice to see the leadership at the federal level acknowledge that we have a public health crisis. They stand up and say we have one. We've got to deal with it. We've got to throw everything we can at it.
This is one of the most sophisticated labs in the United States of America.
We are outside the 100,000 square foot lab just outside the city where much of the region's coronavirus testing will take place.
They are among the first in the nation to get approval to partially automate the testing process for COVID-19.
We're trying to develop as much good quality testing capacity as fast as we can develop it.
Northwell Health stepped up in the fight against coronavirus with the use of a new machine.
Dr. Hugh Kasseri says, why not use a BiPAP breathing machine, which is similar to a CPAP machine, to help COVID-19 patients breathe?
This has not been done before, but Northwell, which is one of our premier healthcare systems, has developed a protocol, and they're teaching the other hospitals now how to do it.
We're ICU doctors. We're used to pressure. We're used to seeing a lot of things that normal people don't see. But this is really beyond anything I've seen in my career.
Dr. Mangala Narasimhan is Chief of Critical Care at Long Island Jewish Medical Center.
I have 18 beds in one ICU full of people on ventilators, completely sedated, unable to open their eyes or interact or talk to their families. It's our sickest patients, and they're in every single room of our ICU.
Dr. Eric Gottesman helped a patient say goodbye remotely.
I could tell that he was going to need mechanical ventilation to be intubated. I talked to his wife on FaceTime. We FaceTimed him all together, and then his wife saying goodbye to him. Very touching.
Ariana Dumas brings iPads to her sickest patients to help them connect with their loved ones.
I was holding the iPad and I was holding her hand, and I'm hysterical crying, and I'm in all my gear, so like my glasses are all foggy, and I was just like, oh my gosh, like how am I gonna handle doing this for multiple people?
One of her patients died on Sunday.
You guys are angels on earth. You are angels that you're taking on this responsibility and being these surrogate loved ones for people who can't be there. I'm sure the families appreciate it so much.
The medical schools graduations were to be happening in 2 months. They will happen quickly, so we'll assign those medical students that were graduating to the hospitals as well.
90% of my residents are taking care of only COVID patients at this point in time. Going through training, we never talked about pandemics. We never talked about what we would do in a pandemic because we just never thought it would happen.
Each morning, Dr. Thomas McGinn of New York's Northwell Health System conducts a conference call with 200 physicians. So far, he thinks they're holding their own, but he's not sure for how long.
The center of the storm is New York City, and Northwell is at the center of that storm.
66-year-old Charles Schlein, a doctor, becoming a patient himself.
I got scared. It's like I thought, well, this could be it. This could lead to death pretty easily.
This uplifting video taken last week at New York Staten Island University Hospital shows veteran physician Michael Sharippa's release from his own hospital.
Barbara Regan herself contracted the virus back in March.
It was terrible. I was scared.
Regan's recovered and then went right back to work. She hasn't seen her 4 kids and 6 grandkids in over a month. Her patients, she says, are all she thinks about.
It's very scary and very real, but the camaraderie that I've seen, I've never seen before.
and it was quite a welcome sight. 46 traveling nurses were greeted by cheers this week as they arrived for training sessions here.
2020 is the year of the nurse. We didn't expect to be celebrating it in this way, but it is so heartwarming to see so many nurses come from so far away to assist us in this time of need.
Doctors are studying whether a key ingredient in the popular heartburn drug Pepcid could be used as a potential coronavirus treatment. There are now nearly 200 patients who are taking part in a clinical trial with Northwell Health in New York. Dr. Kevin Tracy is leading Northwell's study, and he is out front now.
Dr. David Battinelli of Northwell Health says he's found some good news in the numbers.
And we're not seeing the kind of increase in the number of cases that you see in the community in the hospitals.
We are seeing a little flattening. The number of patients coming in each day is being decreasing, and the number of people we're discharging is increasing. That's a good sign.
What we saw inside of North Shore Hospital on Long Island appears to echo what we've been hearing from New York Governor Andrew Cuomo. It's welcome news. We were told that over the last 72 hours, they have actually discharged more coronavirus patients than they've admitted.
Thank you, everybody.
The condition of an 88-year-old coronavirus patient named Rita Rooney is now listed as Code Son. Rita was serenaded by applause from medical workers, and, can you hear it? Here Comes the Sun by the Beatles.
We do have some good news. It's a story that should give all of us an incredible amount of hope as we look to our future with so many unknowns. Urena Soriano was in her third trimester when she developed COVID-19 pneumonia. She was placed on a ventilator. She had an emergency C-section. She stayed on the ventilator 11 days. Yesterday, this moment, her husband put that baby boy in her arms for the very first time. Now that is a reason to celebrate.
Clapping and cheering for a COVID patient who made an unlikely recovery. 16-year-old Carla Duarte was finally released from Cohen's Children's Hospital.
We're also seeing extraordinary success. People leaving the hospital every day. More and more of them leaving today than ever before.
Like Christina Pass, who survived her 15-day battle with COVID-19. The mother of 5 wheeled out of a New York City hospital, reuniting at last with her husband.
I'm eternally grateful to everyone at Northwell, all the doctors, all the nurses.
Hospital staff cheered as they discharged their 1,000th coronavirus patient Saturday evening.
Every day I just feel this gratitude towards my family and friends, and especially towards the staff at Peconic Bay.
A group of doctors and nurses and other healthcare workers outside Lenox Hill Hospital right here in Manhattan, and they got a rousing round of applause from police officers, firefighters, neighbors, just people who came out to say thanks.
Firefighters raised the American flag suspended by their trucks. For 1 hour, firefighters stood in formation, applauding the hospital workers during their shift change.
Having them support us here is just insane. It's incredible.
It feels great having the support. This is awesome. Amazing, amazing, amazing.
It makes me cry.
The healthcare system is resilient. We will handle this. And it's important for people to understand this. You don't quit. You don't retreat. You don't put up the white flag. You are going to win.